Dr. Angela Graper with Family Focused Chiropractic. Today I want to talk about strengthening certain muscles to help prevent low back pain, SI pain, and pubis symphysis pain, particularly in pregnancy. So as we have this increased weight in the front, we have some accommodations that are going on in the back. And so if we keep certain muscle groups that are meant to be strong and they're meant to be fired and activated a lot to be able to maintain balance, then we can reduce the risk of SI pain or sciatica or pubis symphysis pain that a lot of pregnant women experience, particularly later in the trimesters. So we're going to talk about what that all entails. Now, squatting is amazing for pregnancy, but because of the way we move on a regular basis, our shoe wear, etc., we might not have optimal movement in order to do that. So we can adapt in order to do some other exercises to get these muscles firing without making it super uncomfortable or awkward, or when your center of gravity is a little off, it might feel a little weird to go into a squat position. So one thing that we can do, and no equipment is needed, is just basically even squeezing your butt muscles. So as you're sitting at work throughout the day, just letting your brain know where your butt muscles are, because those are the powerhouse to our pelvis and they really help stabilize everything. And then also, another easy one is basically bridging, glute bridging. So we're going to get on our back, and all you do again, you want to make sure that you're squeezing the right muscles in the right order. So squeeze your glutes, and you're just going to push up through your heels. And then with breathing too, you should be doing a breath in, and then breath out is the lift, if you want to also implement proper breathing techniques. In addition, if we want to get some of the external rotators firing more optimally, you would do the same thing and basically put this around just above your knees. So you're not only activating the extensor muscles, you're also activating the rotator muscles. If you're having more pubic symphysis pain, using the band can be really helpful, and those can simply be found on Amazon. Otherwise, you can grab a pillow or a softer ball or something that you have lying around, and we're going to be firing or activating more of our adductor muscles, which actually attach to the pubis symphysis. And so on this one, you're going to actually be squeezing together and then lifting. This is a great tool, especially if you're experiencing the pain in bed and you're rolling from one side to the other, is to sleep with a pillow in between your knees, and before you actually roll, you're going to do a couple knee squeezies to activate those muscles, and that can really take the pressure off that pubic bone, or the joint at least. Now, some other ideas. So if we're not going to be fully doing a squat, and if you do, one idea is to actually have one of those big exercise balls and place it behind you on the wall, and that can help guide you up and down. But something that we can utilize in and outside pregnancy to just help elongate our posterior leg muscles, our hamstrings, our calves, because those tend to get tight from the shoe wear that we often wear, or just how we move in general. So we get something like this. So if you have a towel or a blanket, what you can do, and if you want to multitask, let's say you're working on your laptop and you have a coffee table at home, you could definitely do that as well. But you see, by rolling this mat up, I'm shortening the distance between the floor and my heels, because I probably can't get into a full squat. Now, if you watch a toddler, they're able to play in a squat position, but over time we've lost that ability. So in order to adapt but have more optimal squat position, you just shorten up your heel, but then you're helping elongate the calves and the muscles and your hamstrings anyway. So this is another option where you can play around with that and just listen to your body, see what feels good. Some other little tips and tricks throughout the day to help get certain muscles firing better, to reduce pain and improve like your overall motion and mobility. How many times do you get in and out of a chair during the day? So most people, without even realizing it, do a momentum get up, where we lean back and we throw our hands on our quads, and we use more of our quads and our low back. And this is a huge reason of why we see people with low back pain. We're using these muscles instead of these muscles. So now, sit on your sits bones. Don't tuck under, because this is also optimal for pelvic alignment and especially the health of the pelvic floor. You're going to pretend like you're coming up out of a squat. So you want to make sure that you're on your heels and you're going to stand up like that. If you're experiencing low back pain and you do that first movement and then you do the movement I just showed you, you're going to feel so much stronger and more stable. And so those are some ideas to get your glutes firing more optimally in order to reduce low back pain, SI pain, sciatica, as well as pubic symphysis pain. Thanks for tuning in.